If we look at a CBC that's normal, except the absolute lymphocyte count is elevated, there's a couple of things that I think about. First of all, if this is just a one-off thing, so it's elevated and then on repeat it has resolved, this may be due to mild viral infection that resulted in reactivity of those lymphocytes as part of a healthy immune response. But if it is chronic, meaning it's been going on for more than 3 months, what I usually do next is look for whether there is a clonal process going on. So normally all of your lymphocytes are different from each other as part of a healthy immune system. If we run your lymphocytes through something called a flow cytometer, doing a test called flow cytometry, that will look to see if any of those lymphocytes are all identical copies of each other or a single clone of lymphocytes. This is called monoclonal. And if they find that, it's going to further characterize, well, what type of lymphocytes are those? And often you'll see it's a monoclonal population of B lymphocytes. By definition, monoclonal B-cell lymphocytosis is going to be when that abnormal population of clonal B cells is less than 5,000 per microliter of blood. The way you figure this out is the flow cytometry is going to be reported out as a percentage of the lymphocytes are made up of by these monoclonal B cells. So it'll say 10%, 15%, 20% of the lymphocytes are monoclonal. And then you look at your absolute lymphocyte count and multiply it out. So let's say your absolute lymphocyte count is slightly elevated, it's 4,000, but only 10% of those cells are the monoclonal population, then your abnormal population is 400, and that is within the threshold for MBL. If your population is greater than 5,000 per microliter of blood, this defines CLL. But usually in that case, the total white blood cell count is going to be elevated, not just the absolute lymphocyte count. The reason we care about monoclonal B-cell lymphocytosis is there's a small percentage of people with this that will eventually progress to develop CLL, chronic lymphocytic leukemia, although it is the minority. Hope that helps. Follow for more information about blood.